Number 1. Epinephrine. Epinephrine is used to treat severe allergic reactions, anaphylaxis, cardiac arrest, and asthma attacks. The usual adult dose for anaphylaxis is 0.3 to 0.5 mg injected intramuscularly (IM) in the thigh. For cardiac arrest, the initial dose is 1 mg intravenous (IV) or IO intraosseous, followed by 1 mg every 3 to 5 minutes as needed. Number 2. Nitroglycerin. Nitroglycerin is used to treat angina, chest pain, and heart failure. The usual adult dose for angina is 0.3 to 0.6 mg sublingual (SL) or spray. For heart failure, the dose is typically 5 to 20 mcg per minute IV, titrated to the patient's response. Number 3. Aspirin. Aspirin is used to treat chest pain and suspected heart attacks. The usual adult dose is 325 mg chewed or swallowed. Number 4. Albuterol. Albuterol is used to treat bronchospasm in patients with asthma or chronic obstructive pulmonary disease (COPD). The usual adult dose is 2.5 to 5 mg nebulized or 1 to 2 puffs of a metered dose inhaler (MDI) every 4 to 6 hours as needed. Number 5. Atropine. Atropine is used to treat bradycardia, slow heart rate, and is a preoperative medication to reduce secretions. The usual adult dose for bradycardia is 0.5 to 1 mg IV or IO every 3 to 5 minutes as needed, up to a maximum total dose of 3 mg. Number 6. Adenosine. Adenosine is used to treat supraventricular tachycardia (SVT) and can help to diagnose certain heart rhythm disorders. The usual adult dose for SVT is 6 mg IV followed by a rapid saline flush, with a second dose of 12 mg IV if necessary. Number 7. Narcan. Narcan, Naloxone, is used to treat opioid overdose. The usual adult dose is 0.4 to 2 mg IM or IV, repeated as needed. Number 8. Glucose. Glucose is used to treat hypoglycemia, low blood sugar. The usual adult dose is 15 to 30 grams orally or IV. Number 9. Diazepam. Diazepam is used to treat seizures and anxiety. The usual adult dose for seizures is 5 to 10 mg IV or IO, repeated every 10 to 15 minutes as needed, up to a maximum total dose of 30 mg. Number 10. Dopamine. Dopamine is used to treat shock, low blood pressure, and heart failure. The usual adult dose is 2 to 20 mcg per kilogram per minute IV, titrated to the patient's response. Number 11. Lidocaine. Lidocaine is used to treat ventricular arrhythmias, irregular heartbeats. The usual adult dose is 1 to 1.5 mg per kilogram IV, followed by a maintenance dose of 0.5 to 0.75 mg per kilogram per hour. Number 12. Sodium bicarbonate. Sodium bicarbonate is used to treat acidosis, excessive acidity in the blood, hyperkalemia, high potassium levels, and certain drug overdoses. The usual adult dose is 1 to 2 mg per kilogram IV. Number 13. Calcium chloride. Calcium chloride is used to treat hypocalcemia, low calcium levels, cardiac arrest, and hyperkalemia. The usual adult dose is 500-1000 mg IV, diluted in at least 10 ml of sterile water or saline. Number 14. Furosemide. Furosemide is used to treat fluid overload and edema, swelling associated with heart failure, liver disease, and kidney disease. The usual adult dose is 20 to 80 mg IV, depending on the severity of the condition. Number 15. Dextrose. Dextrose is used to treat hypoglycemia and dehydration. The usual adult dose is 50 ml of 50% dextrose IV, followed by a maintenance infusion of 5 to 10% dextrose solution. Number 16. Heparin. Heparin is used to prevent and treat blood clots in patients with deep vein thrombosis, pulmonary embolism, and unstable angina. The usual adult dose is 80 units per kilogram IV bolus, followed by a continuous infusion of 18 units per kilogram per hour. Number 17. Magnesium sulfate. Magnesium sulfate is used to treat eclampsia seizures in pregnant women, preterm labor, and tossades the points, a type of irregular heartbeat. The usual adult dose for eclampsia is 4 to 5 grams IV bolus, followed by a maintenance infusion of 2 to 3 grams per hour. Number 18. Naloxone. Naloxone is used to reverse the effects of opioid overdose. The usual adult dose is 0.4 to 2 mg IV or IM, repeated every 2 to 3 minutes as needed, up to a maximum of 10 milligrams. Number 19. Albuterol. Albuterol is used to treat asthma and bronchospasm. The usual adult dose is 2.5 to 5 mg via nebulizer, repeated every 20 minutes as needed, up to a maximum of 10 milligrams. Number 20. Glucagon. Glucagon is used to treat severe hypoglycemia, low blood sugar, in patients who are unable to eat or drink. The usual adult dose is 1 to 2 mg IM or subcutaneously, repeated every 10 to 15 minutes as needed.